As we continue to transition back to normal life following the pandemic, a triple threat of RSV, COVID-19, and flu cases are rampant across the country. Western Mass News reporter Reagan Lockery spoke with a local doctor to find out what they're seeing here in the Bay State and when they expect sickness to peak. As we make our way into flu season, COVID-19 remains a threat, along with a rise in RSV cases. RSV is a common respiratory virus that can be very dangerous in young children and older adults. Cases of RSV have been on the rise both across the country and here in the Bay State for weeks, but now experts are warning of a viral triple threat.
One big factor, as I mentioned, is the level of immunity that the population has right now, because we didn't have flu and RSV cases in the last 2 years. So the level of immunity really is low, and so it's a setup for an increased number of cases.
Hospital beds are filling up fast as this triple-demic of flu, RSV, and COVID cases are already beginning to overwhelm medical facilities across the country. So Western Mass News decided to get answers on how it's impacting hospitals in our area. We checked in with Dr. Armando Paez, Chief of Infectious Diseases at Bay State Medical Center in Springfield, who says they have already seen a slight uptick in COVID cases at the hospital. However, flu cases are still minimal. He says their main concern right now is still RSV, as Bay State's pediatric hospital remains packed with sick children.
This is likely a manifestation of people interacting with each other, most likely in the indoor setting, which really is a recipe for transmitting such viruses.
Paez tells Western Mass News it's still early to predict what may be on the horizon this winter. He explains that flu cases usually start to become more prevalent in January or early February. And since we've had an atypical flu and RSV season the last 2 years, it's hard to speculate what's in store.
I think the biggest concern are patients who will get hospitalized, and we have limited capacity. It's really difficult to expand capacity. It's very limited. And so if a lot of individuals need hospitalization and there's only a finite number of hospital beds, then we will be in trouble.
Dr. Paez urges everyone to get their flu and COVID-19 vaccines. And if you're only experiencing mild symptoms, he recommends speaking with your primary care provider before going to the emergency room in order to ease some of the burden off of overwhelmed hospitals. Reporting for Western Mass News, I'm Reagan Lockery.